The following segment is sponsored by Revere Health. Many women who are done having children but have not experienced menopause yet still struggle with menstrual issues. Dr. David Young is here to tell us about the best treatments for this condition. Thank you so much for joining us today.
Yeah. Every day I see someone that comes in that's done having kids, but they're looking at another 15 or 20 years of having menstrual issues. It might be pain or a bleeding issue. And they're frustrated and they want some options for them.
Well, on my drive in here today, I was thinking about this interview and I thought there's so many pros of being a woman and it's wonderful, but there's some cons too. And I'd be lying if I said that menstrual issues wasn't one of them. So luckily you've got some treatments for us. So let's talk about the first one.
Yeah. So I like to break down into 3 different options. So first being some type of medication. The medication could be hormones, it could be a form of birth control, it could be an IUD or intrauterine device that has hormones in it. And then there's one non-hormonal medication called Hysterectomy that can also be used to help limit bleeding.
So what are some of the pros and cons with that treatment?
Well, the pro is that you don't have to undergo some big invasive procedure. Some of the cons, some women are hesitant to put hormones in their body. Maybe they have a family history of breast cancer. Maybe they can't take birth control for a variety of different reasons.
And you've got other options for us as well. I think everyone has heard of hysterectomy, but it can be intimidating. Like you said, it's a bit invasive. It can be a little scary.
Yeah. For some women, that is the best option, but it is very invasive and there's risk of infection and bleeding. There's risk of injury to different things within the abdominal cavity, and the recovery is long.
Who's your ideal candidate for a hysterectomy?
There's a lot of different reasons why we might choose to do a hysterectomy for a woman. There are some other options such as a uterine ablation, and usually we think about a hysterectomy if someone is not a candidate for medication or for a procedure like the ablation.
Okay, so let's talk a little bit about the ablation that you mentioned. What is that and what are some of the pros and cons with that as well?
So a uterine ablation, we actually burn the inside of the uterus. We're intentionally damaging the lining that a woman is shedding. And the procedure literally takes about 2 minutes, and often I do it in the office, and the patient's awake. We give them a little cocktail of medications so that it kind of takes the edge off of things. But 2 minutes or less, and from that point, they should expect a significant reduction in their bleeding.
Oh, wow, that's fantastic. So what if somebody they know that they want to do something, but they don't know which option is best for them? What should they do?
Well, that's a great question. So basically, we need to make sure what options are available. So we need to make sure like a pap smear is updated. We need to do a biopsy of the inside of the uterus to make sure that the tissue there doesn't have any precancer, cancerous concerns that we need to worry about. And I think it's really important that they get an ultrasound as well to make sure that the uterus is a size that is compatible with our different treatment options and to make sure that we give them the best option.
Now, this is a bit of a shift, but I know there's a lot of pregnant women out there that are wondering about this COVID-19 vaccine. Do you believe that pregnant women should get vaccinated?
Yes. Just in the last week or so, the CDC, the American College of OBGYNs, and the Society for Maternal Fetal Medicine have all come out with strong statements to strongly encourage women to get vaccinated that are pregnant.
All right, ladies, you heard the man. He's a doctor and everything here. Now, thank you so much for joining us. We want to make sure that if there's a woman out there that is struggling with these menstrual issues, where can they go for more information and to find a treatment option?
Revere Health, OBGYN Clinic. We have 4 locations in Utah County.
Oh, awesome. Thank you so much, Dr. Young, for joining us today.
Yep, thank you.